Good evening, and welcome to LifeLens TV, where we dive deep into the issues affecting everyday Kenyans. Tonight, our focus is on something that strikes close to home for many: our health system, and the frustrations it has caused for patients and their families. We're all familiar with the promise of a brighter tomorrow, especially when it comes to healthcare. President William Ruto's Social Health Insurance Fund, SHIF, was supposed to be that solution. A new era of universal health coverage for every Kenyan. No more worrying about medical bills, right? But here's the harsh reality on the ground. Families are not just feeling ignored, they are desperate. The SHIF system is in chaos, leaving some patients stranded, their treatment hanging in the balance. Hospitals are demanding cash upfront, and patients are left wondering how long they can hold out. Can they afford to be patient when cancer and other life-threatening diseases are aggressively progressing by the day? Let me bring you the voice of the people, starting with Esther Wambui, whose aunt, battling cancer, found herself in a bureaucratic nightmare. The National Health Insurance Fund, NHIF, had approved 315,000 Kenya shillings for her chemotherapy and 18 crucial injections. But then, like a thief in the night, the transition to SHIF arrived and everything went up in smoke. Since October 1st, this family, like so many others, has been told to pay in cash, 79,000 shillings per injection. Think about that for a moment. For a disease like cancer, time is everything. These families don't have the luxury to sit and wait while systems align, while bureaucrats work out the kinks in an ambitious plan. They need treatment now. Time isn't just slipping away, it's being ripped from their hands. President Ruto recently made an impassioned plea for patience, saying, "In a matter of weeks, SHIF will be serving efficiently." But ask any of these patients, do they have weeks to wait? Esther Wambui's aunt certainly doesn't. Cancer doesn't wait. Infections don't wait. And families are paying the ultimate price. We've even heard stories like that of Samuel Muraguri, whose sister was denied surgery because of SHIF. Out of a 450,000 Kenya shillings hospital bill, only 89,000 Kenya shillings was approved. Imagine facing a bill like that, only to be told the system has changed, and the support you were relying on has shrunk to a fraction. Mr. Muraguri is just one of countless Kenyans stranded by this chaos. It's not just about delayed treatments, this is about survival. So I ask you, the viewer, how long is too long? When your loved one is in a hospital bed fighting for their life, can you afford to wait for the system to catch up? Welcome back once again, and if you're just joining us, tonight, we've been shedding light on a healthcare crisis that is quickly becoming a matter of life and death for so many Kenyans. It's about more than just delayed care, it's about survival. You've just heard the harrowing story of Mr. Muraguri. Imagine needing surgery for a third time, only to be told that your insurance, the one that has carried you through multiple procedures, is suddenly not enough. For so many, the recent switch to the Social Health Insurance Fund, SHIF, has turned what should be a lifeline into a trap. And Muraguri isn't alone. His question echoes the fears of thousands. Do we need to run to the media to get the care we're entitled to? It's a sobering reality that patients now feel like they have to beg, shout, or share their stories publicly just to receive essential medical care. What about those whose voices aren't loud enough to be heard? What about those who are suffering in silence? These are the people at the heart of this crisis. The Kenyan Network of Cancer Organizations and the Cancer Survivors Association are raising their voices, demanding that the government act now. They want full reinstatement of cancer services, both locally and abroad, before more lives are lost. As they rightly say, with cancer, it's not about hope, it's about time. The more time we lose, the more lives we lose. Let's be clear. The promises we've heard of a better future are important, but what good are they if they come at the cost of lives today? Kenya's leading healthcare professionals, including Dr. Davji Atela from the Medical Practitioners and Dentists Union, are warning us. Telling a sick patient to be patient is like telling them to die. Dr. Atela's message couldn't be more direct. Health is a right, not a privilege. If the system doesn't work, hospitals will stop treatment because, for them, it's also about survival, financial survival. They are businesses, after all. And when lives and livelihoods intersect, something has to give. But it shouldn't be the patients who are paying that price. Ladies and gentlemen, this is more than just a broken system. It's a broken promise. Families across the nation are watching their loved ones suffer, unable to afford care that should have been covered. President Ruto's ambitious healthcare reforms hang in the balance, but the cost of delay is becoming too great to bear. The government must act decisively and immediately, because as we've learned tonight, every minute lost could be a life lost. So what now? What's next for Kenya's health system, and more importantly, for the patients who need it to work today, not tomorrow? As we close tonight's segment, I want to leave you with this. Health isn't a luxury. It's not a favor granted by the government. It's a right, and it's one that every Kenyan should have, whether they can afford it or not. The lives of our brothers, sisters, mothers, and fathers hang in the balance, and there's no room for delay, no room for excuses. We will continue following this story closely, holding those in power accountable, and ensuring that the voices of the most vulnerable among us are heard. Thank you for staying with us here on LifeLens TV. I'm Jennifer Harrison, signing off. And if you want to stay informed on issues that truly matter, issues that could save lives, make sure to subscribe and follow LifeLens TV. We are your voice when no one else will listen. If you found this segment informative, don't forget to hit that subscribe button and turn on notifications so you don't miss the next update. Together, we can bring these stories to light and demand the change that's needed. Stay tuned and stay strong.